I'm the Deputy Director at the European Network on Independent Living. And I will just do this very introductory bit. Just a little bit of housekeeping. So basically we have captioning available for this webinar. You can turn the captioning on by clicking on the closed caption button. I'm the Deputy Director at the European Network. I'm sorry, this is the YouTube, which is now speaking over myself. Okay, that's done. I will also put in the chat a link that you can click on in case you prefer to follow captions in a separate browser. We have the chat function enabled and the Q&A function enabled, so feel free to post questions during the webinar. Of course, we will have time for Q&A sessions after each webinar, after each presentation. And I think that's about it. I will hand over to Theodor Mladeno, who is coordinating the Independent Living Research Network at INO, and he will explain a little bit more about the webinar, how it will work, who the speakers are, etc. So over to you, Theo.
Thank you, Ines. Let me just try to share my screen now. Can you see it?
Yes.
Okay. So thank you for the introduction, Ines, and it's good to be part of INO's Freedom Surf this year, and to be able to present the work of INO's Independent Living Research Network. So today we also have Radoš Keravica and Chiara Brennan, two of the members of the Independent Living Research Network and disability studies researchers, who are going to also talk about their own research, and I am very grateful that they agreed to share their research with us today. But before I pass the ball to them, and we will also have some time for questions and answers, I believe, towards the end of the session. So I will start by saying a few words about the Independent Living Research Network that I have been coordinating for a while now, for a number of years, actually. What is the history of this network? What is the vision? What is the aim? And what does the network currently do? And some points about our future plans for the Independent Living Research Network. So it all started for me when I was doing research at INO for 4 years, more than 4 years ago. I was a research fellow at INO, and at that time Jamie Bolling was director of INO, and she asked me to develop her idea of creating an independent living research network. So it basically all started with Jamie's idea, and then we developed the concept for the network, and we developed some further ideas about activities. So The aim of the network, as you can find it on INO's website, is to facilitate communication and joint initiatives among researchers who focus in their work, in their research on independent living and associated topics such as deinstitutionalization, personal assistance, Article 19 of the Disability Convention, and other associated topics. The foundation of this initiative, the foundation of the network are the values and the vision. They are rooted in independent living advocacy, in the work of independent living activists who started the whole thing in the 1970s and the 1980s, when the independent living movement emerged and gained traction. A key point related to the work of the network is that we need to strengthen the presence of research on independent living in society, and particularly in academia and in civil society. Currently, research on independent living is marginal and fragmented, including in contemporary academia. Strengthening the presence of research on independent living, the public presence and the academic presence of research on independent living would strengthen the advocacy for independent living in Europe and in other parts of the world. I believe that this has been the original idea of Jamie when she initiated the network, and I think that this is still a very important task that we need to pursue. Another issue is that research on independent living tends to be dominated by the perspective of service providers, particularly when it becomes more mainstream. INO has always emphasized the perspectives of those who receive services, so-called service users. By being accountable to INO, by being part of INO, the Independent Living Research Network could help keep research on independent living closer to the concerns of grassroots disability rights campaigners. This is also part of the task of the network. And another point to make here concerning the grounds of the network is that it is an initiative that is maintained on a voluntary basis. So my work as coordinator of the network is unpaid, and INO does not have funds specifically allocated to the network. So this whole thing is maintained on a voluntary basis. I say this here to perhaps touch on the point that independent living advocacy and disability rights advocacy more generally is very poorly resourced, very poorly funded, and it is very difficult to compete with mainstream paradigms in disability policy because they are much better funded than us. And that is why disability rights advocacy encounters so much difficulties, so much barriers. The perspective of the service providers is much better funded than the perspective of disability rights campaigners. And the way in which the independent living research network functions is an example of this. The network currently maintains a reading list and a membership database, and I will say a few words about this two activities of the network. The reading list contains references to readings on independent living movement, philosophy and policy, deinstitutionalization, personal assistance and direct payments, austerity as it relates to independent living, the Disability Convention, and specifically references to articles and reports on Article 19 of the Convention that is about independent living and community inclusion. We compiled the reading list at ENO 4 years ago when the whole thing started. And then I got in touch with people who became part of the network and asked them to add references to the reading list. And I try to do this on an annual basis to circulate a message asking members to refresh the reading list. The reading list is available on ENO's website. You can the link is given on the slide, and it is freely available to anyone, basically. And it seems that people are finding the reading list useful from the feedback that I get. As far as membership is concerned, membership is open. So anyone who identifies as a researcher whose work concerns independent living and shares the values of ENO, the values of the European Network on Independent Living, can become a member of the network. There is no need to be based in academia. You can be independent researchers, or you can be doing research for civil society organizations, but you need to do research on independent living, and you can sign up by using the link that is given on the slide. Again, it is available through ENO's website. There is a brief questionnaire that needs to be filled in, and this is the process of signing up to the network. Currently, we have 27 members from 10 European countries. In May this year, I updated the information about membership by circulating a brief survey among existing members, and 27 researchers responded. So this is the current situation with the membership of the network. So you can see that we have a good kind of coverage of Central and Eastern Europe, and United Kingdom and Ireland. So 27 researchers from 10 European countries at the moment. Most members, when I did the survey, they declared expertise in the convention, the United Nations Convention on the Rights of Persons with Disabilities, followed by expertise in independent living movement and philosophy, deinstitutionalization, personal assistance and direct payments, and austerity. Only 2 researchers declared expertise in austerity. It seems that the topic of austerity has kind of become a bit marginal, but I'm sure that it will come back on the research agenda when the consequences of policy responses to COVID are felt across the countries and across the economies. And it seems that we are going to feel it soon. Okay. Moving on, the survey asked the members to indicate their support for a set of priorities that we formulated in advance, and the results showed high level of support for all of our predefined priorities. For the network, the most supported priority was to continue to maintain it and update the reading list, then distribute information about research among members, promote the research of the members, and organize research events, for example, webinars. In their open-ended comments to this question, the members of the network also identified co-production of research as an important priority, including research cooperation among the members of the network and between the members of the research network and other stakeholders. For example, disability rights initiatives, disability rights campaigners, and this is a possible area for the future development of the network, the facilitation of such joint initiatives. And speaking of the future, we plan to launch a web page containing information about individual members. Most of the members have consented to share information about their research openly. So we are preparing this web page at the moment, and it will be part of UNO's website. We also plan to organize webinars on different topics of interest, and the topics suggested by our members include deinstitutionalization, independent living with specific groups of disabled people, mental health users, homeless people, homeless disabled people, asylum seekers, and so on. The topic of intersectionality, the issue of co-production, and specifically of participatory research and research collaborations, cross-sectoral collaborations between academia and civil society, between academia and activists. Another topic of interest is activism, including peer support, solidarity, disability pride. Personal assistance was also mentioned by several members. Independent living, the movement, the philosophy, and what is happening with independent living policies in the aftermath of COVID, and as a result of policy responses to COVID. The convention, the Disability Convention, and its links with the Children's Convention, and focusing specifically on specific articles of the Disability Convention, Article 19, Article 32, Article 12 on legal capacity, and so on. And another possible topic for future webinars is the transnational dimension of independent living activism. We also have been doing for a while a featured researcher series. We have been inviting members of the network to write brief articles about their own research, and we have been publishing these articles in Ino's newsletter, and we intend to continue to do this. A number of members of the network expressed their wish to provide to write about their research, so we intend to continue to do this, to invite people to write about their research in the newsletter. We have already published 6 such articles in the newsletter. And finally, we hope that all these initiatives would help facilitate some joint projects, would help people to get in touch with each other, which would strengthen research on independent living in Europe, but also in other parts of the world. And this could also help with independent living advocacy. We will also continue to maintain and update the independent living reading list as part of the network. So this is what I wanted to say about the network. So for people who would like to become members, you can sign up by using the address shown on the slide. And you can also get in touch with me directly. I have provided my email address as well. I thank you for your attention, and I believe that now we are going to hear from Chiara. Was it Chiara or Radosh that's first after me in the program?
It's Chiara, I believe, right?
Yes, I think so in the program, if I remember correctly.
Yeah, just to say, just let me just see whether we have time for questions now, or perhaps at the end. Ines, could you help with this?
Yes, absolutely. Sorry, I couldn't find my unmute button for a second. We can. We had a couple of comments, questions in the chat, but I think these have been answered. If So I suggest we go on, and if people have questions, we can take them also after Chiara's presentation. So I would
Sure.
I would suggest to go ahead with Chiara.
Yeah, of course.
And yeah.
Hi, everyone. Can you hear me?
Yes.
Great. So thanks a million, Theo, and everyone at Enel for inviting
sorry
me.
to jump in, Chiara. There is something black over your screen, maybe over your camera. Oh yeah, good. It's good.
It's my cable. Thanks.
And sorry, just a note to Theo to stop your sharing your screen, please, so we can see Chiara. Go ahead, Chiara.
Thanks, Inez. So hello to everyone, and it's really nice to be invited here to speak to you today about my own research, which spans 12 years. I've been focusing on the right to independent living and personal assistance across Europe. So starting back in 2009, when the UN Convention was brand new, I've mainly been focusing on the Nordic countries, actually, countries such as Sweden, that were once considered leaders, in independent living and personal assistance, and looking at some of the implications of austerity and of cutbacks in personal assistance in those countries. So I suppose my research has touched on austerity, although I wouldn't really say that I'm an expert in it. It's definitely something that comes up again and again in different forms. So my research has always been activist driven. The main participants in all the research that I've conducted have been grassroots activists in independent living. But more recently, and this is what I suppose Theo has invited me today to speak about, the implications of the COVID-19 pandemic on deinstitutionalization and on the right to independent living. So before I just begin to give a quick overview of the research that I've been conducting in that area, for anybody who hasn't heard of the COVID-19 DRM, there's a report available online, and you can access that on www.covid. What is it? Just 1 second, I'll get the
Don't worry, I can share it. Yeah.
Oh, great, Inez, thanks. And you'll find there a link to the COVID DRM report and the findings and chapters dedicated to the situation of people in institutions, and also on the situation of, or the breakdown of community supports during the pandemic. So what I'll do today is I'll just give a very brief run through of the COVID-19 DRM. I was working as a research and advocacy officer on that project. And the overall project, it was initiated by a consortium of disability rights organizations, including Enel, the Validity Foundation based in Hungary, also the International Disability Alliance, and the University of Pretoria in South Africa. So I suppose the COVID-19 Disability Rights Monitor was established in the early days of the pandemic. And it was a very ambitious project because it aimed to conduct rapid human rights monitoring at a global level in those early days of the pandemic. So the survey that was available online was available in 25 languages, and a website was developed to share the information about the survey and to also share the findings as they were happening. So the Disability Rights Monitor was committed to amplifying the voices of disabled people, and particularly the voices of underrepresented groups, including women and girls, homeless people with disabilities, and people living in institutions. So people that were sort of the hardest to reach. The survey itself received an overwhelming response from all over the world. The vast majority of the respondents were people with disabilities and their representative organisations. So in total, it received 2,152 responses from 134 countries. In addition to this, it also received over 300 written testimonies from all over the world. So this gave a really, really in-depth insight into the individual stories of disabled people from all around the world. So the majority of the responses did come from Europe and from North America. And the countries with the most responses were Germany, Italy, France, and Austria. So there was quite a heavy European representation. So in terms of the findings, if you go and look at the report online, there are several different chapters, but for the sake of speaking at the Freedom Drive, I just wanted to give a quick overview of two of the finding sections. The first one is the findings on the situation of people in institutions. So I suppose what we now know about the people living in institutions is that they were disproportionately impacted by the virus itself, and institutions were at the epicenter of the COVID-19 pandemic. So this situation was brought to the attention of the COVID-19 Disability Rights Monitor back at the beginning of the pandemic. There were concerns about the lack of PPE, the denial of medical care in institution. 1/3 of the respondents said that their government took no measures to protect the rights of people with disability in institutions. But the measures that were taken were often a violation of fundamental human rights. And these included denial of the right to liberty by locking people inside the institutions without access to the outside world. Also a ban on visitors, and also denying medical treatment outside of the institution. So people were given treatment for COVID-19 within the walls of the institution rather than going to hospital. And I'll just share, a direct quote from one of the participants from a DPO in Bulgaria. They said that measures were taken to prevent infection, but it is also a measure that could lead to the lack of care, lack of transparency, and concealment of dangerous abuses within the institutions. The second chapter that I wanted to give a brief overview of too was a chapter that in the report is titled Fatal Breakdown of Community Supports. And I think this title really does justice to some of the responses that we were receiving from around the world. In terms of people living in the community who were saying that there was a complete breakdown of services and financial supports that enable them to live independently. Only 6.5% of the respondents said that they received any extra financial assistance, despite reports of significant increase in the cost of living. One of the interesting things to emerge here is that, it didn't matter whether people lived in Switzerland or in a very low income country. we received reports from all over the world that the cost of living was increasing, but yet people were not receiving any additional financial assistance. 38% of people said that they did not have access to personal assistance during the pandemic, and a further 33% of people said that they did not have access to informal care during the pandemic. So I suppose in relation to these findings, I just thought I'd finish up the talk by just discussing, I suppose, some of the potential implications of these findings for the independent living movement. I suppose one of the great things about conducting rapid human rights monitoring in real time was that we now have an evidence base of the abuses that occurred during the pandemic, and we have written testimonies from people all over the world documenting this. So again, I would invite anyone who's interested to go onto the COVID-19 DRM website, and there you'll even find direct quotes of people explaining how the pandemic has affected them. Another implication of the findings is that they show a direct link between policy responses and human rights violations. So for instance, the implications of isolating people in institutions during the COVID outbreaks show that there was, a direct link between isolating people and the institutions becoming the epicenter of COVID-19 outbreaks. I suppose on a more positive note, and this is, I suppose, moving away from the disability arena, there is evidence elsewhere of alternative and effective policy responses to other minority groups. So, for instance, in some countries around the world, governments actually implemented policies, rapid policies, to house homeless people in places where they had space to self-isolate. And for this reason, it's interesting to look at alternative policies that weren't necessarily implemented in the response to people with disabilities, but it goes to show that governments have got the initiative and the resources to put into, creating better policy responses in this field. So I think there's a lot to learn, particularly from the early days of the pandemic. But it's also important to recognize that we're not out of this pandemic yet. So there's still that evidence base that we've collected to show probably mostly what not to do, and that might hopefully have some positive implications in the future. So that's basically what I have to say, and I'd be happy to take any questions later on.
Thank you, Chiara. Thank you for this. It sounds depressing or infuriating. Depends on how you on your framing of the issue. I would prefer to get angry and depressed, because anger can motivate action and social change. We have now 10 minutes for questions, and I see in the chat box that we already have one question by Anne Galpin. She says, in the UK, some disabled people had do not resuscitate notices pinned on their medical records without any consultation or consent. So was this done in other countries? This is the issue of the lack of access to emergency health care on the basis of basically utilitarian or even one may say eugenics, type of mentality or thinking. So could you please respond to this?
Yeah, actually, the do not resuscitate order was it was flagged quite early on in the survey by a participant in the UK. So I think since then a lot more evidence has come out on the scale of that. In regards to other countries, like I haven't seen any any evidence emerging, but I have heard stories certainly in terms of DRN and just more generally the denial of adequate healthcare. So for instance, we did have stories from Eastern Europe, I think Romania specifically, whereby people were locked into the institutions without receiving adequate healthcare. And then, of course, the staff were transferred to the hospital when they got sick with COVID. So it does show, I suppose, that level of inequality. It's a very stark reminder of, different treatment for different, people living in the institutions versus the staff and whatnot. But, I think this is a much wider issue than just the DRN. Like the DRN is obviously a very shocking example, but we have, just other examples of basic denial of adequate healthcare, and that really came out strongly from the DRN findings. So yeah, it's a huge issue, and it's unfortunately, I think, in a lot of countries.
Yeah, it seems that in the emergency response to the pandemic, governments all around the world kind of regressed to kind of an earlier modes of reacting and thinking about disability. And this had grave consequences for disabled people. It seemed, at least in the first stage, it seemed that years and decades of disability rights advocacy and advancement have been effaced. Yeah, but let's see whether there are other questions or comments.
Maybe I can comment a second, Theo, if you allow, if nobody else has questions. I just wanted to say, because we've obviously, as Chiara mentioned, we've been working together on this, or we've been a part of the group of organizations. So just wanted to say, I mean, and Chiara has done really a fabulous job at going through these thousands of testimonies. So I just wanted to say it was such a good initiative to get so many voices of people, really powerful testimonies and experiences, and we don't really see enough of that. I mean, there have been loads of surveys related to COVID, looking at the experiences of various different groups, subgroups, but I think this was just the sheer kind of mass of experiences from people directly, which took a lot of effort to get as well. But just wanted to say that we definitely should be doing more of that, or researchers should be doing more of that as well. And maybe just to say that we are very happy that the COVID DRM has also inspired the Committee on the Rights of Persons with Disabilities to start the working group on deinstitutionalization, and to also launch a set of regional consultations, again, to hear directly from disabled people all over the world. So we're happy with that result as well. And yeah, I just wanted to thank Yara, because I know it hasn't been easy, and she's managed to pull out really the key themes, and from the independent living perspective, because of course you could have looked at it in various different ways. But I think from our perspective as ENIL, Chiara, you've pulled out really the key themes. And like you say, hopefully it will lead to a better response in similar situations in the future. But yeah, just a little comment.
Yeah, a question to both of you. How was this initiative funded? Because in order to enable people's voices to be heard, we need resources, particularly when it comes to this large-scale international type of research that can really illuminate the scope of the issue.
I can say it was funded a little bit like the Independent Living Research Network is funded. We haven't received any, special funding, for this. So the key was really having so many organizations involved. A lot of us that don't have a lot of money, like ENIL, we've simply contributed with our time, with translations, with, just disseminating the survey, etc. We were happy that one of the organizations, which was the international IDDC, which is the International Disability and Development Consortium, they were able to allocate one of their members was able to allocate some funding so that we could hire Chiara to do the analysis and to do also some advocacy work for us. But it was just it was 6-7 organizations involved, so everybody pretty much contributed with their time, and that's made it possible. Otherwise, for one organization to do this, it wouldn't have been possible.
So no external funding for this, just pulling resources together and doing something with what's there, basically.
Yeah, just to comment on that as well, Ines, because I came in later on at the analysis stage of the project, and it just felt so big. There was so much energy around it, and it had that real grassroots feeling as well, that it was coming from rights organizations, and just like the response that we got from something that was that ambitious. It's just incredible, from all over the world, and just people actually taking time out of their days to write, sometimes almost essays on their own experience. And I think that just really shows how much of an appetite there is out there for people to really try and voice, their experience. And it was just such a pleasure to be part of that DRM initiative, because I felt like it was really something big. It really grew into something big and exciting and impactful. Hopefully, the impact will continue.
Yeah, I'm happy to hear about this follow-up by the committee, and hopefully it will make the situation for affected people a bit better. Then this is exactly what the research network tries to do, basically to encourage sharing of research that can make an impact in the real world. Okay, thank you. Thanks a lot for this. We now have a 10-minute break. We have one more question, just very quickly before we do the break from Angaupin again. So were there also positive comments, say, to greater opportunity for inclusion for some disabled people by holding, for example, meetings online like the one we are having now? Chiara?
Yeah, we did. Yeah, I suppose I probably talked about all the negative things today, but we did also outline some positive initiatives that were taking place in different countries around the world. I don't recall specifically, about meeting online. There were a few examples, of monitoring of. Particularly, DPOs responding at the ground level to the emergency in the early days of the pandemic. So there are those positive stories from countries, like Palestine, like Moldova. They're just a few of the ones that I can remember that were included in the positive examples. So it wasn't necessarily coming from the countries in the world with the most resources. Sometimes it was very much grassroots efforts on the ground, that like organizations sourcing and distributing PPE or food or whatever. Like, it was just
yeah,
there were those positive examples.
I remember reading the report that I was impressed by this emphasis on actually the positive things, the help coming from disability organizations, from civil society organizations, much more than coming from government bodies. And as usual, it was the civil society that took the hit and responded more adequately. It seems, yeah. Okay, so let's do the break now. We were planning a 10-minute break, so until 5 minutes past 4. Central European summertime. Okay. And then we'll get back again to hear from Radoš about his research on the convention.
Thanks, Sarah. And just to say, while we're in the break, I will play a couple of songs, not myself, but we've had Dennis Queen, who is a singer-songwriter from the UK, and they record songs about independent living. So they have recorded some songs for this Freedom Surf.
Wow.
And they will not be captioned because we actually want to give the captioners a break. That's the reason for our break. But they will be on our YouTube, so we will try to caption them after the event. But for those of you who are not getting a cup of tea or something, feel free to listen to Dennis. And yes, we come back at 5 past, as you said, Tao. Just try to share.
holding on against the wind and rain, still there behind the shadow of the pain. We are peeping out again, peeping out again. Holding on against the wind and rain, just surviving those of us who made the grade. We are coming out again, we're rolling out again. Come on. Holding on despite these hateful days. How many of our people have been taken that way? We're speaking out again, we're signing again.
all you do in your DAW, whatever DAW it is literally just drag and drop. You can drag one of these chord progressions in.
Okay, hi again. Time to get back to our session this afternoon. And after this wonderful song, we'll have the pleasure to hear from Radoš Keravica, who, like Chiara, has worked for INO for many years and is currently doing research at the University of Leeds. And we'll hear from Radoš about the monitoring of the United Nations Convention on the Rights of Persons with Disabilities and the new developments in these monitoring initiatives. So Radoš, it's to you now.
Thanks, Theo. Like as Theo said, I'm serving as a board member to INO. But I'm in the moment working as an early stage researcher at the University of Leeds and the Center for Disability Studies, which means that I'm yet to obtain my doctoral degree, so I'm actually enrolled in the PhD. But today I'm going to talk not about my research project, which I'm doing at the moment in Leeds. That's the project which investigates the experiences of disabled children of participation in healthcare decision making, to what extent they have the say in medical decisions, and to what extent their childhoods are maybe over medicalized. But I'm going to talk today about some work that I did before in my previous roles, something that is more adequate and relevant for the purposes of this session, which aims to discuss, as Theo said, the monitoring of the Convention on the Rights of People with Disabilities. And I used to work for United Nations for Office of High Commissioner of Human Rights in Serbia, and OHCHR did interesting work around indicators of human rights, around indicators for Convention on the Rights of People with Disabilities, and this is the work that is published quite recently, like in December last year, if I'm not wrong, and this is something that might be incredibly useful for all of us engaged in disabled people's movement and in the process of monitoring the convention. So let me just share my screen, the PowerPoint, so you can see my presentation. So I hope that you see the slide using the indicators to monitor, or not yet. Do you see anything?
Not yet, Radoš.
Take a second. Okay, I think it should be visible.
Yeah, it's visible now.
Yeah, so as I said, OHCHR under the banner of this Bridge and the Gap project produced, along with IDA, International Disability Alliance, the package which aims to help DPOs to monitor the policies that countries implement related to sustainable development goals, but also the set of indicators to monitor implementation of specific articles of the Convention on the Rights of People with Disabilities, including Article 19 that I will be talking more about during my presentation. So let's first reflect a little bit on that. What are the human rights indicators? So what we are talking about when we are mentioning this term indicator. So basically, one quote is saying that it's a collection of rank order data, right? That purports to represent some project performance of different units. So essentially, it is those are the tools which are helping us to get the idea, in this case, how the countries are doing in performing their duties to implement fully the CRPD. So it's telling us something about this social phenomenon of disability rights, to what extent countries are making this a reality, these promises that they made by signing the CRPD. Yes, Theo.
Yeah, sorry to interrupt you. There was a request to make the slides a bit bigger. Can you do it?
A bit bigger. I don't think so, but what I can do is maybe to delete the picture and maybe augmentate the letters. I don't think that there's something. Oh, is this working?
Yeah. Great. Thank you.
All right. So basically, yeah, it's just a tool that helps us to assess how good or bad the countries are doing in implementation of the CRPDs. So it's actually helping also to figure out what are the standards of implementation, because the articles itself can be a little bit vague. So I would say that you should regard indicators as an additional tool which help to clarify what are the standards of human rights norms enunciated in the CRPD. So now I have to make it small again so that I can shift the slide, and then I'll make it bigger. Okay, I hope this works. So sorry for this little bit of fiddling with it. So United Nations produced particular methodology how to make these indicators, right? So they said we call this methodology structure, process, outcome, which means that first we're looking to make the set of indicators which talks a little bit about the structures that exist in the country to support the implementation of the CRPD. So, for example, this is the foundation which underlies the whole process of implementation. For example, existing laws and policies. For example, if you're talking on Article 19, that might be the fact if that country has or doesn't have the institutionalization strategy. So this is one structural element that by itself, it doesn't mean anything. It doesn't mean that disabled people are enjoying the right to independent living, but it tells something about the structure which exists in this country, which may be more or less conducive to implementation of Article 19 in this case. Then there are some process-related indicators, right? So which really look into what countries are doing, what kind of processes they put in place to make the independent living reality for disabled people. So, for example, we might be looking in the sums of money, the allocated budgets that the state is putting for implementation of the right to personal assistance, for example. That might be one indicator, the budget allocated to personal assistance in the country. And then finally, what really tells the story about how independent living is achieved, or whether it is achieved or at all in the country, and to what extent people enjoy this right, is the outcome-related indicators. And this is really the statements about what is the state of play in the country, how many people are living in residential care institutions, for example, or how many people enjoy and access personal assistance. So this might be also one outcome-related indicator, right? So all these three are important, and United Nations developed and presented as a tool to us indicators pertaining to all these three areas: indicators related to structures, processes, and outcomes. I have to make it small again, and then to turn the slide. And you will also notice, I will show you, of course, the full list of indicators, and I will tell you where to find it and to explore it more in depth. But just to mention that you will notice that some of them, well, maybe even most of them, are quantitative indicators, which actually are the ones which are expressed as numbers, percentages. For example, percentage of the GDP, gross domestic product in the country allocated to mobility aids, for example, if we are talking about Article 20, or personal assistance if we are talking about Article 19, or various items spread out through the convention. Number of people living in the institutions, this is also a quantitative indicator expressed through the number, right? But there can be a number of qualitative indicators, and those are the ones expressed as narrative descriptions, telling the stories, what happened, what kind of development happened in certain country. And I'm sure if you explore more that research that Sierra was working on about COVID related situations and experiences of disabled people, that there are many narratives, qualitative narratives and stories of disabled people, which are actually also revealing to what extent countries are implementing their duties related to CRPD. And here there are two links that you can use to assess this website, where OHCHR published this tool package and the materials related to sustainable development goals and the indicators of the convention, right? So we will be sharing these slides later on, but I will now stop sharing the PowerPoint, and I will take you to the website using those links, so you can see, you can visualize where these things that I'm talking about can be found. So let me just figure out how to share my Google Chrome. Just a second. I'll stop sharing for the moment this PowerPoint. Okay, it's coming in a second. Yeah, I think it's visible now. Like this is the first link that is taking you to the page of the Office of High Commissioner for Human Rights. And the title of the page is saying Human Rights Indicators on the Convention on the Rights of People with Disabilities. And if you scroll a little bit, there will be quick links, and then you can click on this Human Rights Indicators of the CRPD. And then the next page will open. So here in the first part of the screen, you can see policy guidelines for sustainable development goals, because as I said, the United Nations created for us this package, which on one hand is helping us to investigate like the policies that countries put in place to implement sustainable development goals, right? This is not the focus of my presentation right now, but just I'm informing you to know what you will find on the same page. So then you see here goal by goal SDGs. It might be useful for those people engaged in the SDGs work as well. But when you scroll down underneath the SDGs, you see here human rights indicators on the CRPD, right? And it goes article by article. I think it's very useful. And I'll show you a couple examples of these indicators. But it goes through all substantive rights contained in the CRPD. So you see Article 1 to 4, so those are about general principles, general obligation, but then it starts article by article, Article 5, 6, 7, 8, and I will talk a little bit and show you the examples from the Article 9, right? Article 19, sorry, living independently. And you can access it in 3 language versions, but I downloaded it, so I will stop sharing this screen on the website, and we'll get back to the PowerPoint to show you a couple of examples and to tell you finally why is it useful at all to know about indicators, right? Okay, so I hope that you can see on the screen again the PowerPoint, and I'm going to zoom a little bit. So what's the point about indicators? As I said in the beginning, they're actually
sorry, Radosh, you don't have to enlarge it anymore because we found a view options, and it's possible to enlarge the whole screen. So I think it's fine now.
The tricky thing is that now I can't.
If you can put it back.
Because a little bit, it's cold a little bit here, and then my hands freeze, and I can't do this fine movement with fingers. Okay, so let me just try to stop sharing again. Okay. All right. Yeah, I think it's good. So basically, they tried to operationalize each article of the CRPD, which means that they try to make it as concrete as possible to let everyone know what does it mean to implement article, what those norms contained in each of the articles mean in reality, right? To make it as concrete as possible. So first, the part of the work they did is that they tried to break down the articles in the so-called attributes, right? So you will notice when you download the document with indicators for each of the articles that it's listing the attributes of each of the rights. And if you remember, Article 19 has these 3 paragraphs. You know, the first paragraph is saying about the choice of independent living arrangements, that every person has the right to choose with whom and where to live. Then the second paragraph is saying about disability related support services like range of in-home services, personal assistance, etc., etc. And then finally, third paragraph is saying that all other mainstream facilities and services in the communities, they should be accessible as well for disabled people. So they kind of broke down this into 3 so-called attributes, and then they proposed number of indicators for for those attributes, some of them talking about structure, and I gave you here the examples of these structural indicators. This is just examples that I included in the PowerPoint, but I will switch later on to the full document just so you can see, you know, how it visually looks like. But here's some examples of the structural indicators. So, for example, they're mentioning comprehensive national strategy and plan with timeframes and measurable goals to implement this, right, including the availability of a range of housing options and support services, and then more specifically, adopting a national strategy to achieve the institutionalization. So basically, that's what we call an annual institutionalization strategy or the action plan. So the point is to assess whether the country has documented all as an underlying structure for implementation. And then saying also one additional structural indicator is whether the country adopted a moratorium on new admissions through forced institutionalization of persons with disabilities. Whether the country adopted a moratorium on new admissions to institutions of children with disabilities. So these are all, you know, indicator by indicator telling you which data you should be looking for to tell whether your country is implementing the CRPD. So this list, of course, is not exhaustive, you know, because their aim is to make things as universally applicable as possible. Of course, there will always be a need to develop maybe some country-specific indicators and to offer additional information other than that. But nevertheless, I found this incredibly useful because it's still helping both countries when they report. Okay, I'm definitely not saying about PowerPoint. I'm not sure how to overcome. But also, yeah, for DPOs when they're making their own monitoring reports and doing shadow reporting, essentially. Yeah. Okay. All right. I definitely messed up something with the PowerPoint, so I'm really sorry about that because now I can't turn it, you know, to be able turn it back to be able to shift the slides. So okay, well, let me stop sharing, you know, and focusing on a discussion. In the meantime, I will share the board which I intended to share with all indicators, just to have a, you know, feel how it looks like. I know that you can't read now the indicators, but don't worry. When you download the document, this will be how it looks like. So it's a comprehensive to quite extent, you know, because here, you know, at the top, basically they said, you know, we have 3 attributes, 3 paragraphs, you know, choice of independent living arrangements that I just said, support services, and accessibility of mainstream services. And then, you know, they were going, you know, telling about structure, which policies, you know, and plans that there should be in place. Then later on, when you scroll a little bit down, you see the indicators related to process. So I'll just read out a few which I found interesting. So for example, things that are helping us to learn about the process, what countries are doing is number and proportion of public sector staff and private actors involved in the housing policy and market, trained on the rights of persons with disabilities and on relevant aspects of this right. So for example, the training that the country is providing to public officials, this is also considered as a process leading hopefully to an outcome for disabled people to enjoy this right. So trainings, monies allocated to certain purposes. So this is all the process, you know, this is not the goal in itself. This is means to an end because it's leading hopefully to something, but as itself, it's not telling us yet about to what extent disabled people enjoy this right. But then you scroll down and you see indicators related to the outcome. So for example, one outcome is elaborated here. So it's saying number and proportion of adults with disabilities, right? Reporting satisfaction with their level of independence in their living arrangement. So for example, what is this telling us? It's telling us that it's quite challenging sometimes to get the data because it requires research. It would require countries to investigate, some money to conduct the research, because you need to have the survey, quality of life survey, getting the data from people, so you can figure out whether they are actually, satisfying with their living arrangements. Or you have, of course, the indicator number and proportion of persons with disabilities released from institutions, or number and proportion of persons with disabilities accessing community-based support services, right? Number of institutions being closed down. So this is also included. So I would invite you definitely to explore this website of theirs and the list of indicators, not only for Article 19, but also for other articles. And you will definitely notice that, it should be critically read, meaning that, there are things certainly to improve and to figure out whether you can collect data on this at all. It's the question whether the governments are transparently, publicizing this data, whether this is available for you, but also to work with the governments, to help them figure out, which kind of statistical systems to establish and which data to gather, but also to figure out whether these are appropriate indicators in your opinion. Because as I said, it should be really critically read. There is an annex, explaining some of the concepts. For example, they tried to explain the concepts. What does it mean, residential care institutions? It's a good thing, for example, they include group homes under the definition of an institution. This is something that TNL is really advocating for. But there are a number of other issues that I noticed that are a little bit contested, and that's why I'm saying it should be taken with a level of cautious. But nevertheless, it's good maybe to look at those indicators and to see whether they need to be changed for your context or improved, or shifted somehow to respond more to the needs of your countries, right? And so I think it's a good starting point. It's not, UN didn't announce it as a prescriptive tool, that now you have to report, under these documents and populate these indicators. It's more like a supplementary, tool to CRPD to help with the interpretation and to help with the reporting and data collection, bearing in mind, many countries are really struggling, with the absence, the lack of data. So, yeah, let's maybe discuss, because this is approximately where in my PowerPoint I would end if I didn't have the troubles with it. So let's maybe have a discussion.
Thank you, Radoš. Indeed, indicators are so important, and your presentation very clearly showed why they are important and how where to find the indicators that can be used, but also the importance of thinking about indicators critically and not taking them lightly. So we are a bit over the time now. Ines, can we have like 5 more minutes for questions, or shall we?
I hope it's okay with our caption or norm. Thank her in advance. I think yes, maybe 5 minutes, just in case
Yeah.
we have some questions.
So yeah, I would like to ask our audience to comment, make questions. Here is one from Ann Galpin, really helpful tips on where to find information. Radosh, something I've certainly found difficult to navigate. Thank you. So again, thank you, Radosh, for this. Other questions or comments?
Maybe I'll comment again because I don't see any questions, but and thank you, Radosh, for the presentation. I found it useful as well. Are you saying that there are definitions then included? Because that's what I would see as a problem, I guess, for many things, that things are open to interpretation. So would you say that they have tried to include definitions for the various terms?
Indeed, for example, like under each contested term, if I may say so, like they included footnotes, in this annex. So if you scroll, right to the bottom of each of these documents, by document I mean the document pertaining to a specific article. So for example, they clarified what are the key features of personal assistance, right? And the list is maybe not comprehensive as Enel is defining, what are the core features of personal assistance, right? But that's why I'm saying, like, let's, look at it critically. For example, they are recognizing, that there can be both, the form of direct payments and the provision through service providers. They're clarifying that, with the consent of the person, the personal assistant could be shared, with other person. So it's interesting, how they came, to these definitions, but they did try to include, some sort of definitions.
Yeah, I mean, a related question would be, indeed, how did they create these definitions, and were they consulted with disabled people's organizations?
If you remember, like from the last autumn or the last year, like I remember that there was a letter circulated through Crpd info list, like asking, the DPOs to comment to the draft of those indicators, and actually everybody interested, to provide input. So yeah, there was some consultative process, like underlying whole endeavor, but yeah.
Maybe just to add, Tao, that we actually have another session on Thursday. We're looking at monitoring Article 19. So I know, we will have Gerard Quinn, but also colleagues from the Independent Living Institute in Sweden. They've had a project on monitoring Article 19. I don't know if they've used these indicators, so it'd be interesting to see what they've used themselves, but just so people know that they can also join that. Let me just double check the time, because there will be more talk specifically about implementing this in practice.
So I see Maria is asking in the chat, were these indicators used already in some country? Well, knowing that it was just recently published in the beginning of this year, I don't think there are information yet whether they are systematically used by some countries. I think that no country has comprehensive, existing statistical system to capture the data to populate all of these indicators. So I don't think that we know whether in the reporting process under CRPD they actually used this.
Yeah, Kapka has also made a comment in the chat that the indicators need much more discussion, and it kind of goes back to what Radosh, you were saying, that we need to be critical with these indicators and discuss them. But also, I think that it also goes, it also touches on the question of how were these indicators produced, the question of the who of policy making, which is so important and so often kind of disregarded.
I see Kapka is asking a question like the Bulgarian government is actually saying that they close down all institutions, but yet they have group homes. So how would the indicator be applied? So I said that's the good thing that they, recognized in these indicators that group homes are certainly a form of residential care or institutional care. So in such case, there would certainly be a resistance, I assume, of Bulgarian government to use this indicator and say in their data that, oh wait, we still have number of disabled children being institutionalized, meaning being in group homes. So I guess that would be now a struggle between disabled people's movements to advocate for these indicators if they consider them appropriate with their government to actually use them to populate them with the data.
This could be a good advocacy too, actually. Yeah, because as you said, the group homes are defined as forms of residential care in the document. So this can be used as an advocacy tool to criticize the process of deinstitutionalization in Bulgaria.
Maybe, Teo, I suggest we stop here just because we've run 10 minutes over time already, if there's no questions.
Yeah, it's high time to finish. I just wanted to thank Radoš and Chiara for this fantastic presentations and for being here with us today. I think that what we heard shows the power and the importance of research on independent living or related to independent living, and I hope that we'll be able to take this work further together as a network. And thank you, Ines, for the support with this session, and the song was fantastic during the break.
And thank you to Teo for all your work on the network, of course. And again, thanks also from my end to Radoš and to Karen and to Norma for captioning, and to everyone for joining us today. And if anybody's missed the session, it will be on our YouTube channel. So and we can provide the presentations with the links as well. So thank you everyone who was with us today. And shall we close the webinar? Okay, thank you. Have a good day. Bye.